The recent depression epidemic in the United States has left us with many questions. Where does depression come from? What are the symptoms? And what are the best ways to treat it?
But a lot of people get that. Think about what creates a depressive atmosphere. It's almost everywhere you look, you know. The way we have to live in a busy society. And sometimes people just can't cope with all the stuff that's going on in their lives.
There's about 9.2% of people who are depressed. And over the age of 60, about 15% of the population are depressed.
Well, everybody probably experiences depression in some form. There are several levels of depression. Clinical depression, probably 18 to 20 million people. A lot of people are medicated for depression beyond those clinical depressed people. It seems like when we get a little down, the first thing we do is get Prozac or an antidepressant or something that pulls us out.
I'm a nurse practitioner, and I taught nursing for 9 years at Blue Mountain Community College and for 4 years at Oregon Health Sciences. And while I was teaching at Blue Mountain, I had the opportunity to work at Umatilla County Mental Health. They needed some some help with developing their medication management for the chronically mentally ill. So that gave me an opportunity to work between a psychiatrist and a psychiatric nurse practitioner for quite a few years and get some good experience there.
We're going to cover the gamut. How on earth do you identify if you've got it? Recognizing the stuff when you know you have it. What to do with it. Because I think that's the biggest piece. I've got it. I don't want to keep it. How do I get rid of it?
What we want to look at is kind of what depression is, and we hit a little bit on that of sometimes it can mask as pain or other things and not be the typical idea of what we think of depression. We will also look at different etiologies or things that cause depression. Then we'll look at how to evaluate and see if it is depression.
But all age ranges could benefit from this, because depression doesn't respect age or gender or anything. It just comes. If they want to deal with whatever's going on or deal with someone else who has it, like in the family, then they probably ought to come.
Come join us at Village Church for a journey into joyful health with Robert Egbert and Patrick Smart, starting January 26th at 2:30.